Hello, I am Dr. Pritesh Junagade. I am a consultant hematologist, oncologist and a bone marrow transplant physician. I am associated with Ashoka CC Hospital as a visiting consultant. Hemato-oncology is a branch of medicine which deals particularly with the science of blood cancers, cancers of the lymph nodes, some cancers of the bone inside called a bone marrow. So basically is the study which involves the diagnosis of blood cancers and treatment of blood cancers. Leukemia is a Greek word meaning leukos means white cells and emia means increased white cells. So basically that means when your white cells in your blood are raised or increased. In olden days it used to be called a cancer. Still today we are using this word, but actually it means abnormal white cells being increased in your blood and the rise in the white cell count which are abnormal or cancerous, that leads to a leukemia. So that's the actual factual meaning of leukemia. Basically leukemia is of two types. First we say it's an acute leukemia. Acute means fast moving, and chronic means slow growing. So when you say acute leukemia, the leukemia or the cancer comes very fast. The patient might be fine 15 days ago, and when they present to us with a high white count, we may be able to diagnose them with leukemia. Chronic leukemias are a different kind of leukemias where it's a slow growing tumor or slow growing cancer cells. There are many subtypes of chronic leukemia. So I think what you should know, the main difference between leukemia and other cancers is basically leukemia when diagnosed is always in stage 4. The first question I get asked when we tell a patient that someone has a blood cancer, the first question is, doctor, which stage is this? And that's a very natural question what they ask us. What I always tell is it's actually stage 4 because it is diagnosed in stage 4 because cancer or leukemia is diagnosed when we actually do a test or call a bone marrow test, or sometimes the cells are present in the blood itself. So when the cancer cells in blood and blood flows everywhere, so everywhere the cancer cells are growing, and that's why blood cancers are always in stage 4.